What I think I'm gonna do is find some fat acceptance TikToks and then, react to them live, watch them with y'all, and then, comment and everything. And then I'm just gonna cut out all the awkwardness later. So yeah. Let's see.
Anytime I talk about the problems with the BMI, the most common response I always get is, okay, well, what should we use instead? And the answer is nothing. Get rid of it and replace it with nothing. We literally don't need it. If a patient needs to be assessed for an illness, doctors use diagnostic testing to do that. If a patient has an illness, the doctor will treat that illness. If medications need to be dosed based on weight, there are formulas that already exist to calculate those dosages. If a doctor wants to educate a patient about the benefits of health-promoting behaviors, they can and should do that with all their patients. There is no medical scenario where the BMI or any tool like the BMI is the most effective, most specialized tool for the job. None. We already have systems and tools in place to meet whatever a patient's specific health needs may be. Categorizing and pathologizing patients based on weight is and has always been lazy medicine. Anytime I talk...
Okay. So, first things first. So this is a discussion on the BMI. What I get from this is she seems like a person that is hurt by the BMI. Now, I'm not going to lie, the BMI definitely has some issues with it. But I think that those issues really only occur if you are somebody who has a lot of muscle on you. Or if you're somebody that's like maybe really tall or like really short. But as far as the average person goes, I feel like the BMI, within reason, is a good determining factor as to whether or not you're overweight or, especially as you get into the morbidly obese territory, because I'm morbidly obese. So I'm assuming that this lady is morbidly obese as well.
I
can't see her body, but I'm assuming that she is morbidly obese. Do y'all think that she's morbidly obese? I feel like she probably is. Yeah, the BMI is a good determining factor as soon as you get up into those weight levels. Now, as far as it being a determining factor for like, medical conditions and everything, being fat, like being overweight long term, 100% does contribute to medical conditions. And I think the BMI is a great tool for that. If you need an indicator, if you're obese, this is the same woman that said obesity is a slur. Okay, wait, Charlotte says, it's not perfect, but it's nice to have another data point to watch your progress. More self-awareness is a good thing. I 100% agree there. The BMI has faults, 100% has faults. However, if there's nothing to tell us if we're obese or, like I said, morbidly obese or even super morbidly obese, then there's no way that you can determine if you're more at risk for a health condition or something. Because by what this woman is saying, what I'm getting is that she's just saying you should just administer medicine by weight, which could be a thing. However, how are you supposed to get the information that you're more at risk for a health condition? I feel like BMI can be a good determining factor in that, And like you said, Charla, if I'm trying to because I'm definitely trying to get out of the morbidly obese category. It's not a pretty category on the BMI chart. And I know I'm morbidly obese. Like, it's not like I just have, a bunch of muscle and I'm like, oh, I'm not morbidly obese. The BMI is lying. That doesn't apply to me. That applies to super muscular people, not to me. So, yeah. Let's see. Don't tell me she has something bad to say about blood pressure.
Let's talk about blood pressure cuff sizes, because this is important information everyone should know.
Okay.
When healthcare providers use a blood pressure cuff that's too small, either because they don't know any better or because their practice chooses not to stock big enough cuffs, it will always result in a false high reading. And fat people have our blood pressure taken with cuffs that are too small all the time, which means that fat people are frequently misdiagnosed with hypertension and then put on medication to lower our blood pressure, which is super super dangerous if you don't actually have high blood pressure. So my husband Chris, who's an EMT, is going to explain how a blood pressure cuff should fit and when to ask for a larger size.
So this is a normal blood pressure cuff. On the inside, you're going to see a range marking, anywhere from about 25 to 40 centimeters, somewhere in there. On the outer edge, you'll have a little white line right here that's going to line up somewhere in that range when you Velcro it. If that white line stays inside that range when you Velcro it, for example right here, that means it's going to fit normally. If it is outside of that range, that means it's too tight or too small, and it's not going to give an accurate reading. So if you see that white line going outside of this range at the clinic, make sure to ask for a larger cuff size.
Let's talk about blood pressure.
Okay. Charlotte, it's one of my goals. Oh, yeah. I completely understand that. Like, live streaming it's hard. It's really hard out here. Like, even getting like comfortable to talk in front of the camera and all that is challenging. So I really do appreciate you being here. And I want to tune into your live stream as well. Let me know when you're doing that. But, as far as comments about this goes, let's see. Okay, Charlotte, I'm a nurse practitioner. Oh, you are? Oh, wow, that's awesome. That's a hard field. We appreciate everything you do. Okay, I'm a nurse practitioner, and I was going to say what he just said. There are markers on the cuffs that we use to determine the size of the cuff used. Come on now. Oh my gosh. Okay, thank you for highlighting that, because in my mind, I was just thinking like, so that would mean that the person deliberately chose a smaller cuff and put it on you. But if it's odd because the evidence that she chose right here is doing nothing but disproving her claim. It's kind of dark in here. Hold on. Okay, awesome. Y'all can see me good now. But the evidence that she put here is doing nothing but disproving her claim, because there are literal markings on the cuff showing you if it's big enough or not. And I feel like if it's tight on you, which, blood pressure cuffs should be, it should kind of stop the circulation to test your blood pressure. So I don't really know what she's going on about here. It's supposed to stop your circulation, or at least, constrict it in a way so that it can take your blood pressure. So I feel like this is just another one of those excuses. Personally, I feel like it's another one of those excuses, unless you have been at the doctor and then you've untaken the cuff and then you're like, hey, my arm doesn't fall within those white lines. Then I'd understand if she had that experience. But honestly, it's just seeming like she's just pulling this out of her, behind to see. Oh, they'll pop off if they're too small. Okay, thank you. Thank you, Charlotte. Thank you for helping me understand this, because, oh my gosh. It would definitely be a fail on them for sure. It would be a fail. But if they pop off, if you don't use them right, then that's just another excuse. It's giving BMI. It's giving, oh yeah, if I was somebody that was really muscular and then the BMI told me I was overweight, it's wrong. But you're not a person that's muscular. You're morbidly obese. The BMI works. The BMI works for people like us. It may not work for bodybuilders, but it works. It works for us. So it's giving that. It's giving that 100%. Okay, let's see. Dang, we haven't been live for that long at all. Okay, let's try. Dang, I'm just going in on Hannahtalksbodies right now, but I love her TikToks because they put out, she's trying to be educational with it. She's trying to be smart with it, like put out some intelligence, trying to bring out scientific facts and medical terminology, trying to actually educate people. And the thing is, she's not educating people. So I love intelligent conversation on people who are wrong. So let's go ahead and view some more from Hannahtalksbodies. No. Basic surgery story. There's no correct timeline. Serving clients of different sizes. You know what? I'm just going to choose any of them. Let's see. Okay, let's go.
Story time. In June 2013, the American Medical Association held a meeting to vote on whether or not they would choose to classify obesity as a disease. Now, those of you who follow me know that I hate the word obesity, but we have to use that word in order to talk.
She thinks obesity is a slur. If you watch my other Fat Acceptance TikTok video, she thinks the word obese is a slur. That's what she means when she says she doesn't like the word obesity.
About this story. It's important to note that a year before this meeting was held, the AMA asked their Council on Science and Public Health to research this issue and provide a recommendation, which they did. So they all gathered at this meeting to hear the recommendation and then take a vote. And lo and behold, after studying it for a whole year, the Council on Science and Public Health said that obesity should not be considered a disease. This was for a number of reasons. First, they said that the BMI is just too flawed and it makes it nearly impossible to accurately identify obesity in the first place. They also explained that many people who are above the obesity threshold on the BMI are perfectly healthy, which flies in the face of everything we know about diseases. For example, you can't have cancer if you have none of the symptoms of cancer, etc. But ultimately what they said is that there are no specific symptoms for obesity, and that the only thing we really know about it is that it can be a risk factor for other stuff, but it's definitely not a disease on its own. After the AMA heard the council's data and recommendation, they voted, and by a 60% majority, they voted to classify obesity as a disease. Despite the recommendation of the council, they asked to study this.
Okay, I get what she's saying here, right? So let me just clarify. Obesity in itself being a disease, I mean, okay, fair. I could see it not being a disease. I guess my mind, a disease is kind of something that like unwillingly, causes effect to your body. I feel like obesity, at least in most cases, when you're as big as like we are, it's kind of just based on your life choices. That's just my opinion on that. However, so we're back at the topic of BMI here now again, right? So for some people, you can be classified as overweight on the BMI, yet still be healthy. Yes, that is true for some, especially if you have more muscle. Looking at this woman, now I need to look on her TikTok and see if I have a full body picture, but just looking at her and, the structure of her face and her hand, because, we got them fat hands. It's giving we are obese and we belong to be classified as obese on the BMI. The BMI being flawed doesn't apply when you have 50% of your body in fat. Like the last time I got my breakdown checked of like muscle and fat and bone and tissue or whatever, my fat was like 45% or something. And I can't know that and then get a morbidly obese rating on the BMI and then confidently say, the BMI is wrong. I'm perfectly healthy. I can't say that knowing that. Like having that knowledge in my head, there's no way I can say that. I'm not sure. Like I said, I don't know the breakdown of this person. I don't know anything like that. However, just looking at her, I'm pretty sure that we probably have at least 40% of our body as fat. I'm not disproving everything that she's saying. It is true that the BMI is flawed, but that's only when you're a person that it applies to. You can't deny the fact of being fat or overweight. Okay, Charlotte, it's frustrating this is even a topic. The point is being overweight is a medical issue and we work hard to help our patients understand the risks it poses to health. She should focus on... Okay. Pretty sure that the character limit capped on Charlotte just then. I don't think that it's a disease. And like I said, she's right about that. It's not a disease, but it is 100% something that makes your health get worse. And Charla, how we should work to better ourselves instead of denying being overweight. 100% agree. So you being overweight, you being obese, these are medical terms. This isn't the same as somebody calling you like fat and disgusting or a rhino or whatever, like whatever insults that people use. This isn't the same. This is just a medical classification. And that isn't, it's just not synonymous with that. And yeah, there was one more point that she said here that I wanted to point out. What was it? Like, let me rewatch real quick. Not rewatch the whole thing, just skim through.
They also explained that many people who are above the obesity threshold on the BMI are perfectly
healthy.
It's definitely not a disease on its own.
All right, she said a risk. Okay, yeah, a risk factor for other stuff. The risk factor is actually pretty high though. I don't exactly know what it is. I don't want to look it up because I don't want y'all to see my internet history, but I'm pretty sure it's something like it multiplies your chance for like heart disease or like any other condition, like bone conditions or whatever, you know, having like joint issues. All that is due to having a high fat percentage on your body. So yeah, it increases your risk factor, but it's pretty significant. And you know, this lady up here, she looks fairly young. I am also fairly young. And if you watch my last fat acceptance video, which I will link in the corner after I edit this, it talks about how women are getting older and then saying like, I'm getting health issues now. Like, yeah, I was a cute plus size model when I was, 35 and below, but they're getting health issues. They're getting like, joint problems. They're getting heart disease. Me, myself, I have an issue with my period. Now, I haven't talked about this at all on my channel, but I have an issue with my period that's due to me gaining a lot of weight, and excess weight will mess up your hormones. Now, this isn't the case for everybody, but that's something that I'm dealing with right now. I don't have high blood pressure or everything. Maybe I'm like healthy, but that isn't something that, is good for me. Sweetie, I gotta see a patient. Oh, thank you, Charla. Thank you so much for being here. I am so happy that you came here. And please message me on like Instagram or something like about your live. I definitely want to tune in. 100%. Thank you, Charla, for being here. Oh, Charlotte's so sweet, you guys. Make sure y'all check out her channel, by the way. I'll leave a link to that in the description because Charla is like definitely a goat. But yeah, it's weird, y'all. Okay, I think I'm going to do one more TikTok here, and then I'm going to go ahead and cut this live stream because it's already 1:28. I kind of wanted this to be like a 30-minute live stream, so we're going to go ahead. 1524 Scooter. Oh, hey. Hi. I know that you are new here. I got a notification that you subscribed to me. I think it was like yesterday. It was really like recent. So thank you for being here. It's nice to see you too. We're just looking at TikToks, and this woman, she's really known for saying this wild medical stuff about it. She is a trip. She is a trip. I feel like everybody who knows about fat acceptance stuff, like they see this face. You've already gone through, I think, like 2 or 3 videos of hers, so I'm gonna do one more, and then we're gonna dip out of here. Ooh, this one has 1.6 million views, so we're gonna click this one and see what she's saying.
Story time. I've talked before on this page about how I have severe chronic back pain that I've had since I was like 5 years old, and I have done everything imaginable to try to fix this, including having a breast reduction. Now, that might be hard to believe given that I currently have huge boobs, but believe it or not, 6 years ago I did in fact undergo a breast reduction. When I had my first appointment with my surgeon, she asked me what size I wanted my breasts to be, and I told her that I wanted C cups, which was a significant reduction. And she was very surprised by this. She said, "Oh no, that's way too small. Given your weight, that won't look good on you." And I told her, I don't care, I'm trying to alleviate my back pain. And she sort of let it go for the time being. Then, on the morning of my surgery, she was taking care of all the final details before I got wheeled into the operating room, and she asked me again to confirm what size I wanted. And I told her again, C cups. And she literally responded the exact same way she did before, as if that conversation never happened. She dove into her whole diatribe about how it wouldn't look proportional and it wouldn't be attractive. And again, I told her, I don't care, that's not why I'm doing this. So anyway, when I woke up from surgery, I had double D's. Because
okay, this one, honestly, I don't really think I have many comments on this. It's kind of just like, she didn't do your breast reduction right. I don't think this has anything to do with fat phobia in my mind. I mean, like, Okay, this is a live stream, so I'm not even gonna comment on my chest, but I feel like that's like me going and then asking for like a B cup. They're gonna be like, no girl, you look silly. So I don't know. I don't really have any comments on this in terms of like fat acceptance. But yeah. Yeah, Ricardo, that's what I'm saying too. Like, I mean, okay, they didn't follow what she said. I mean, I'd be upset about that too, not gonna lie. But like I said, I haven't seen this woman's entire body. Oh wait, there's something here.
When I was still in...
She knows she don't want no C cups. That's all I'm saying, y'all. Like, okay, this kind of just proves everything I was saying before. She has a high body fat percentage, so the BMI being flawed doesn't apply to her. She's 100% obese due to the BMI. We're not talking about somebody with a lower body fat percentage that just has some muscle on them. This woman is obese due to the BMI. I am obese due to the BMI. Like, the BMI is valid in our circumstances. So 100%, she knows that she obese. She knows that she's obese. Because I was saying all this without knowing how her body looks. So I wasn't 100% sure. I can't comment on people's decisions. People want to look how they want to look. If she wanted C cups, then she could have had C cups. You know, that's all I'm saying. But, you know, and like I said, I would have been upset if somebody disagreed with me on that too. But what I will say is I can understand the woman's, like, the doctor's thoughts on this, like the surgeon's thoughts. Like, I probably would have been like, just so you know, you're going to look kind of silly. And I would have gave her the C cups. But maybe the surgeon thought she was doing her a satisfaction. Like, I don't know. Wait. I found it. Scooter, don't be mad at me. But it was literally the second video from the top. Don't be mad. Look, I tried searching it on YouTube and it didn't pop up. But I should have just went. I was looking through the videos on her channel though. Look. Oh my God, Scooter, I'm so sorry, but I think I think we found it now. Okay, let me...
Story time.
Okay, story time again. This is 2 minutes. It's kind of long. We're going to do this. Clean private houses. Ooh. Wow, that's awesome. That is super awesome. I could never. Yeah, I actually work with computers, so... And then you wonder why I'm up here trying to lose weight. Look, I need to move more. I need to move more. And I am losing weight, by the way, but I need to move more. But that's awesome. So do you get to see, like, you know, cool houses that you would never see on a day-to-day because of your job? Thank you, Ricardo. I appreciate you. Because, oh my God, we out here struggling. But okay, let's go. Let's go. All right. Here we go. We're back at it. Last one.
I have had severe chronic back pain my whole life, ever since I was like 5 years old, and I have done literally everything imaginable to try to make it better with little to no success. My pain got progressively worse over time, and about 4 years ago when it became particularly severe, I decided it was finally time to consider surgery, so I made an appointment with an orthopedic surgeon. At the appointment, they weighed me, they x-rayed my back, and then they had me wait for the doctor. The doctor came in and very quickly let me know that I needed to have a spinal fusion surgery, and I needed to have one as quickly as possible. He showed me the x-rays and explained that I not only had a spinal deformity, which I already knew, but that the friction between two of my vertebrae had caused a fracture. So I had a broken back. And I was like, got it. When can we schedule surgery? But he responded and said, well, the problem is your weight. Unfortunately, we're going to need you to lose some weight before we would be willing to do surgery on you. But luckily, we have an in-house weight loss program that we're going to refer you to.
Okay. Pretty sure this is the video. Also, Scooter, that is so awesome. Like, is it, you know how some people when they're working, they can feel free to like put in their ear pods and then listen to music and stuff. Well, I mean, I guess you're here while working, so I guess that's probably what you can do. But that is so awesome. That's really cool. But yeah, I'm pretty sure that this is a video. I just stopped it right here really quick just to comment. So I'm assuming that her spinal deformity is probably, you know, the one she was born with, like you said. She's had back pain since she was 5. However, due to the things that I just said a couple moments ago, being overweight does put pressure on your spine. There are tons of surgeries, not even back surgeries, tons of surgeries where you have to lose weight in order for you to safely have that surgery. They won't even give you weight loss surgery before you've lost enough weight for it to be safe. So this isn't this. Okay, that's all I'm saying. Like, if you even have to lose weight to get weight loss surgery, don't think that you getting a back surgery is because of this doctor being fat phobic. Is that what this is going to lead to? Is she going to be like, this person was fat phobic because they wanted me to lose weight before my surgery? Because if she does that, wow, that's all I'm saying. But all right, let's go.
Too. And there are many things I could have said in response to this, but I decided to try to appeal to this doctor as someone who, in theory, should want to do no harm. So I told him, I have a history of disordered eating, and weight loss behaviors are very unsafe for me. And by the look on his face, he clearly did not believe that I ever had an eating disorder. And so he said again that I would need to lose weight, and he said the reason was because anesthesia was too dangerous for people in my BMI category.
And that's true. That's true. It's true that surgery can be dangerous for people as their weight climbs up. Like, you can't be under anesthesia for so long because all the weight around, like, your lungs or whatever can compress it. Or even, like, how you're more likely to have sleep apnea, the more, like, fat and stuff pushes on your neck, and that, like, actively affects your breathing when you're under. This doctor is concerned for you, and they don't want you to die trying to get back surgery. This is not fat phobia. If that's where she's going with this, I already know it's going somewhere wild because she's her. But, like, that's what this is. This is concern. Even if y'all watch My 600-Pound Life, you know how Dr. Now is like, in order for me to give you this gastric bypass so you can lose weight, you have to lose enough weight so that we can be comfortable enough to put you under anesthesia for long enough. The doctor has to be confident that you're going to wake up, like you're going to wake up from the surgery. It was really bad when I was fat. Dang, I get pains now. And it doesn't mean that regardless of what size you have, you can have back pain. It just means that if you lose weight and you put less pressure on your back, the pain is going to be lesser. That's all that it means. Those are two things that can coexist. You can lose weight to put back pain off. And yes, you can still have the back pain, but it doesn't change the fact that losing weight is going to help that. It doesn't change the fact. Okay, let me finish hearing what she's saying.
And I said, so how do people even bigger than me get weight loss surgery every single day? They are under anesthesia.
Okay, let's see.
For that. And we went back and forth for a long time, and he ended up getting very frustrated and just said, look, I don't know what to tell you. This is the hospital's policy. So I had to battle this hospital with this horrible BMI cutoff policy for a whole year, all while having a broken back that entire time before I could finally get the surgery they had established was medically necessary. And by the point that I was finally able to get this surgery, they had made me wait so long that over the course of that year, I had developed permanent nerve damage, which is extremely painful to this day and has radically changed how I have to live my life. And that would not have happened if they had just given me the surgery on the same timeline as a thin patient.
You know, what's crazy is that regardless of how much heavier the person is than her or whatever surgeries, it really all boils down to the person that's giving you the surgery. Because there are people like Dr. Now from My 600-Pound Life where if they're 600 pounds or so, maybe he'll be like, I don't know, get to 450 pounds. And he feels comfortable enough to do that surgery on them without them losing their life. If that doctor was not comfortable enough, or even that hospital was like, we're not going to take any chances, because even then, people that are heavier than her, it's not like there's a 100% success rate. There have been people on My 600-Pound Life, and Dr. Now, he's a GOAT of surgeons. There are people on that show whose heart have stopped while he was doing the surgery. He had to quickly abort the surgery, bring them back to life. So those people who are getting those surgeries are at an even higher risk. This hospital is like, nah, we're not taking no risks. We need to make 100% sure that you're okay. So even if her chance is lower than those other people, there's still a risk there. And that's what she has to understand. If she didn't like it that much, she could have taken that year and put effort into another surgeon to do it for her. Another surgeon that would have been like, oh yeah, You're not too big, let me do it. But instead she chose to fight with the hospital. Just to prove a point, what? That the doctor was fatphobic based on the hospital rules that he didn't set. Ricardo says she has to understand that they could do more harm than good if they did the surgery before weight loss. 100% agree with you. 100% agree with you. Back surgery, Scooter says back surgery is even more delicate than stomach surgery. Yes, because Scooter, that is such a good point, and I didn't even think about that, because the surgeries that Dr. Now does are stomach-based surgery. He reduces your stomach. And her specific example there was, why are people with more, like, higher weight than me getting weight loss surgery? That was her example. And Scooter, I am so glad that you said that, because those are stomach surgeries. Back surgeries, if you mess up one part of the back, you could be paralyzed for the rest of your life. Literally the rest of your life. It makes sense that there are such stricter conditions on getting back surgery. I'm so glad you said that, because I didn't even realize the distinction there. But you are 100% correct on that. And if she sat there and got paralyzed for life, what would she be like now? She wouldn't be like, well, I had a non-fat phobic doctor, but I'm paralyzed for life and I did it to myself. No, she would have been like, somebody should have told me the risk factors. Like I swear she would be up here looking stupid and paralyzed. Oh, and Ricardo, about what you said, they would do more harm than good if they did the surgery before weight loss. Yes. Because she has to realize, even if you put yourself in somebody else's shoes, you have to realize, like, am I going to put this person at risk for something that is, like, scientifically proven to be harmful, to be, like, at a risk? Or am I just going to do it because she's mad? And it's unfortunate that after a year of battling that the hospital just did it. I mean, but honestly, they're probably just tired of her complaining, and we're like, okay, here's all of the records that show her, fighting us continuously, seeing if we're going to do the surgery. And then if she dies, this is what she wanted for a year. So, hey. Scooter says they aren't even very successful for thin people. Yeah, back surgery is a really tough one. It's a really tough one. Like we said, it's really risky. It's a risky surgery. And if you mess up one thing in the back, that's your whole life. The spine is like so central to the rest of our body. Yes, Ricardo agrees. Wow. That's wild. I would really like to revisit this one day, and instead of doing it live, have a time to like collectively gather all my thoughts regarding this, and then just write out all of the reasons as to why she was wilding. And Scooter, you made up a very good point about stomach surgery versus back surgery, because weight loss is not, synonymous with back surgery. So thank you for pointing that out. I would really like to revisit this and give a more, thoughtful answer on the topic. But yeah, I think that's it for the live stream. Let me make myself big here. Hold up. No, okay. Y'all know I've been struggling this whole time. I'm just trying to say goodbye in a proper way. Okay, I think that's good enough. Oh my gosh. But yes, Scooter, thank you so much for tuning in. Ricardo, thank you so much for tuning in. And Charla, she was here earlier. She was a nurse practitioner. I think I have the chat going up, as this live is rolling. So y'all be sure to check her out. She is really cool. And yeah, thank you so much, Scooter. And if you guys want to see any more of this, live streams like this, make sure to leave a like on this, comment down below, all that. And then I'll see you guys next time once I find out how to stop the stream.